The reason that I work at Sinnissippi is because I was looking for a place that was going to promote professional growth and a place where I could feel supported in kind of achieving my own personal goals as well. And after doing research and talking with other people who had started to work here, it felt like it was going to be the best fit for me.
I work at Sinnissippi because of the work that everyone here does and the impact that it has on our clients. I previously came from a radio station, and it was a really fun job, and people love their entertainment and it is important to them, but I felt like it wasn't significant enough, it wasn't substantial enough. So when the opportunity came to come to Sinnissippi, I really liked the idea that we would be having such an impact on people's lives, helping them out with their substance use disorders and mental illnesses and other things that we do. And I think that was very important to me at the time.
When I was in fifth grade, the first time my first experience with suicide, and it was a classmate, so 10-year-old kid. And then in the same school year, my adult cousin also died by suicide. Both cases on the surface were made out to be very circumstantial, momentary lapses of judgment. And at 10 years old, that was good enough for me as an explanation. But as I got older and started seeing it more and more in the world, I needed to understand more of why this happens, and then it became more of a how can I intervene and what would that take. So if possible, I thought I'd best apply myself to helping people.
I like to help clients and staff become the best versions of themselves and grow with what they like to do.
I've always had a passion to help people. I actually wanted to start out in nursing and that didn't work out. So being in social work allows me to help people on a lot of different levels. I can help advocate for their needs, help them in their recovery, help link them to other needed resources that they need to help in their recoveries.
It's kind of funny because you would think, marketing, what is the impact? Well, we might get more clients in, we might get more referral sources, but the real impact and what made my day one time and my week and my year is I was at an open house, I believe it was, at our Rochelle office. And they said to me, Andy, a client wants to talk to you. And I thought, oh, well, this could be a complaint or, what's going on or what's the problem or what's the issue. And so I went to talk to the client, and she told me that she'd heard me on the radio. I do a live radio appearance every month on the Rochelle radio station. And she says, I was having troubles, and I was thinking about suicide, and I heard the 800 number, and I called it, and I got help. And that, like I said, made my day, it made my week, it made my year. And that is the reason when I get the privilege to hear client stories like that about what is the impact of marketing? That is the impact of marketing, that somebody can find out about us, seek the help they need, and get on to the road to recovery, and that's just incredible.
Despite what people experience, what choices they've made, what family environment they grew up in, what diagnosis they've been labeled with, at the end of the day, helping people recognize that they're worthy and deserving of having healthy and safe connections with other people is so foundational to joy, happiness, whatever other words you want to put in that.
Because I love what I do. I love my coworkers, and we're able to joke and have a good time throughout the day. I get excited to see my clients and what they have going on. It's just a great place to work.
I get out of bed in the morning and come to work here to support the mission and values that we have. I do enjoy working with the population that I serve. I enjoy the people that I work with every day, and I enjoy the connections that we have in the community to help positively impact people's lives. I chose Sinnissippi in the first place because my interview experience in the Rochelle office was actually very comfortable and warming, with HR and a supervisor and some of the clinicians in there. I didn't feel overwhelmed. I felt very comfortable. I've stuck with Sinnissippi because every supervisor I've had, everybody that I have worked with has been welcoming and warming throughout different offices and positions. People have helped me grow in my career from going from a bachelor's degree to a master's degree, and then going on to get licensed. I just feel like there's a lot of pieces to Sinnissippi that truly help people personally and professionally.
It's kind of the client first mentality that is very genuine about the agency. I really appreciate that, and but then also that employees' mental health is a huge deal as well.